That's like I just that it's basically it's a battle. It's a real war. It's real war in the hospital. That's a terrible part of COVID. So when you stay at home, you stay in a community, you do not feel it at all. What you see is just beautiful weather, everybody cooking, stay at home, right? But when you really go to the front line, you see virus is just like a ghost there, and they are threatening you anytime because they're so contagious. If you just did not pay attention, like you just turned, like you pushed a button on the elevator, you forgot to clean your hand, you might get infected. After 3 days, you show up your symptoms. At that time, your family already be exposed, and so you're not yourself, could potentially be threatening. It's real tough. So it's like front line. There's so many people infected around you. It's like you're getting into an environment, you have bullets shooting around. So you're hiding and hiding all the time. And you still don't know, because when you go so many times close to virus, eventually you could get infected. And as I know, even in Massachusetts, in Harvard Medical School, their hospitals, they are the best in United States. About 10 to 20% of their healthcare worker probably get infected. So those is really, we in the front line, we're real, those soldiers. We have to move on. No matter what, you have to move on. You cannot quit. And but there are bombs and the bullets everywhere. You can be shooted anytime. Even you're young, you still have a chance to die, because about 2 months ago, there's some resident, only 33-year-old, the ENT doctor, after 6 years of prolonged residency, hardworking, he's 33-year-old, he has 3 kids. In Detroit, he died, and he left over 3 kids, very young kids, at home with his wife. So those are very sad story. But as a physician, you can choose to quit, but I think most of us, include the nurse are wonderful. Also the tech at this time, they're wonderful. They still move on, not only in hospital, but in nursing homes. Although I do not work in nursing home, but I have a lot of nursing home friends who are doctors, and they told us, right now, 1/3 of the deaths of COVID in the United States is in nursing home. And also around St. Louis area, some of our one nursing home have like more than 40 cases. In through hospital, we usually daily cases around 20 to 30. So think of a smaller nursing home, you have more patients than a big hospital. And those nursing home patients are very sick, and they're basically taken care of only by the nursing staff. And so because COVID going on, those seniors in the nursing home not able to be visited by their family anymore. So only nursing staff have to feed them, take care of them all the time, right? But those nursing staff, like few weeks ago, they have no mask. They have no protection. Everybody knows if you touch the patient who could be infected, then without protection, your chance of infection is very, very high. It's more than 50, even 80%. So that means when you go back home, you cannot live with your family, right? Otherwise, your family are affected. So those tech, actually nurse and tech, they're not highly paid, but they have to, in such a tough situation, they're taking all their responsibility to take care of the patient, then nurse one by one, they got sick. I heard some of the nursing home, the nurse manager gets sick, then the assistant nurse manager gets sick. So nurse, those healthcare workers, one, they got sick. And after you're sick, you have to stay at home. Otherwise, you can spread to the patient, right? So the nurse become less and less, and the people left over have to take more and more work. And so this is probably the worst time in our career. But I think because the faith in our heart, the responsibility in our heart, we have to move on, have to, even it's a bomb, even those people you contact in this, if you go, you have big chance being infected, but you still have to go. So that's how scary, how difficult your feeling is. One is all those tough situation. Another thing is the working environment is really in the front line. It's real war. Like I still remember the first time at the beginning of March, I contacted the first case of COVID. Because at that time we already learned from China, from Wuhan, that how bad this disease is, right? You might have chance from hear from your family that because Wuhan had the worst outbreak at that time, and so in Wuhan, those hospitals who located really in the center of the infection, at the mid of January, some hospital, when later the other troop of doctors coming to help them arrived, the hospital, the whole ICU team, everybody get infected. So that bad. So in the March, when I heard first face the COVID patient, I showed just like a normal human being. I was so scared, just like you're facing a ghost is coming, but you don't know how to deal with it. And even like infectious disease, I know how to protect myself, but we do not have the best like bunny suit you saw on the TV. We do not have. We just have usual gowns, which is level 2 protection. In Wuhan, eventually they use the level 3 protection, but in United States we do not have. So we have to use lower level of protection. So you of course have chance to be infected. So the first time you enter the room, your life will be changed, because when you're coming out, all your colleagues are scared of you. They are running away from you because your potential could be contagious by this virus. But I think life is moving on. It's already 2 months, and we already got through the worst time. Worst time is probably around the end of March, and at that time, really lack of mask, and without mask, you still have to see the patient. Also, we lack of testing, because we do not have enough testing kit. So you see a patient, you don't know what's going on, right? If you know that patient is COVID, then you can protect yourself. If you don't know, that patient just show up. We have several patients show up without typical symptoms, because COVID is like just like bad flu symptom, right? But we have many patients coming with diarrhea, bleeding. They do not have any fever. They come in, and next day they start have fever, cough. Then you already be exposed. You already contact patient. You already have big chance of being infected. But at that time we do not have enough testing, so you don't know who you are dealing with. You don't know even whether the virus is there or not, right? So you could not be protected enough. And so So I think right now is from that time to now, it's getting better. And now we have more PPE available, more masks. Everybody at least have masks. And we know a little bit more. We have more medications. Remdesivir is available as a study medication.